Well, thank you, Jamie. And what you just experienced is dialogue. And that's part of the richness of being a member of a society. People say they join a membership society to network with others. And that's exactly what we did today, is a tremendous amount of networking. And I would imagine that everybody here is walking away saying, I met somebody new, I learned something new, and I feel a better person because of it. And I would pose that there is another reason why you need to be here, and another reason why membership associations are so rich. And that's that mentoring part that we all have a role in responsibility. As I've looked over the past few days and learned from so many of you, and many of you are GSA members, and I'm very honored to be here to represent them, that I say that we all have a role in mentoring the next generation in this topic of aging as a disease, or however you want to phrase it, but we need to continue to nurture and grow this next generation. A big obligation and a mission of societies is to inform our members on topics that are gaining a lot of momentum. And the topic of metabesity and geroscience is certainly one of those. But it also provides an opportunity for the early research to be published and opportunities for dialogue on that early research. So in order for you to better understand who I am and where I come from, I am the Vice President for Strategic Alliances and come from a different path than many of you, but I work with a lot of you. I work with almost every single pharmaceutical company. Many of them work with us, and when I heard today that there may not be an understanding of aging on the pharma companies, I can tell you that there are champions in almost every single company who's looking at the aging business. They realize that they're in the business. They may be focused on a certain topic area, but they quickly realize that they're in the aging sphere, and they come to us to make sure that they better understand the market, they know the trends, and they know where they need to place their efforts. We are a professional society focused on research, education, and practice. Certain there's the good top quality research in this country and in the world. We help advocate for the research that's needed, research dollars. And we also advocate to ensure that the next generation of those who teach physicians and health providers and social workers are well versed in the field of gerontology. Our membership is exactly what we've been talking about today. It's exceedingly diverse. We have behavioral and social scientists, so researchers, educators, policymakers, and practitioners. We have those in the biological sciences. Matt Kaberlein is one of our top members. He's the head of our section in biological sciences. We also have health sciences, which are physicians, dentists, nurses, pharmacists, nutritionists, and others in allied health. We have social research and policy, social workers, not to be forgotten here, social policy, economics, sociology, political science, pastoral planning. I think I heard that there were some ministers here. Emerging scholars, our next generation, and then the academicians. So it's all looking from a 360 perspective in gerontology. Who's at the center is that patient. So where are the advancements coming from? How are they going to be applied? Who's going to help that person apply that? What are the policy changes that need to affect to ensure the advancements can be fully taken advantage? That's where our membership society really shines. As I mentioned, we are a publisher. This is a list of our top publications, and you can see the number 1 and 3 and number 5. Those are the high impact factor journals that we have. Biological sciences, medical sciences, psychological sciences, social sciences. You know, just this morning I was talking with an attendee, and they said they learned a lot the day before. They were really distilling it, but they heard opposing views in the room. And what did they do? They went back to a journal article from a peer-reviewed journal to better understand the issues so that person could better understand where they were going to move forward in. Peer-reviewed journals are incredibly important for our research, important places, but they're also very important to discuss and have dialogue. One of the issues that's one of our publications is Public Policy and Aging Report. When topics start to garner tremendous momentum, we dedicate special issues and sessions to it. This is a brand new publication, has just come out, and we've secured open access for everybody. Let me show you who's the authors on this. Matt Kaberlein, who was here earlier, J.L. Shansky, Matt Kaberlein. These are fantastic articles, but you might see some more names. Look at this. There's Ann. There's Thomas. So this whole issue is really looking at the big issue of aging is it still a disease, perspectives from geroscience. As Matt Kaberlein wrote, now is the time to begin preparing for the reality of effective approaches for delaying aging in people, with policymakers, research funders, regulators, officials, medical professionals alike. And they should understand that interventions in biological aging is possible and making its way into the clinic in an unregulated marketplace. So I draw your attention to taking a look at that issue. We also have the largest annual meeting in the field of gerontology, and it's coming up just in a couple weeks. So if I look a little stressed, it's because we've got 4,000 plus people who are coming to Austin to learn all about everything. But I thought it'd be good for you to see a couple things that are going on at the meeting that might make you want to come to Austin. Our friend Joan, who just spoke a few minutes ago, is speaking at a session called Aging as Disease, Implications and Repercussions. We've set up, in addition to the hundreds of sessions, scholarly presentations, we defined a program called Momentum Discussions. They're 1-hour sessions designed on topics that are garnering a lot of momentum. You all have good handle on this, but rank and file may not. And so this is an opportunity for a real good discussion with the panel, but more importantly, discussions with the audience. And remember, it's a very diverse audience that we have, and many societies do in fact have diverse audiences. And it's that richness of discussion that we've all heard today that can that will move the needle in the right direction. And how great was it that I was sitting next to you, Joan, and you helped me understand my respiratory problems. So this has been a great meeting for me today. But I thought you should see a few other things that are happening at our meeting that reiterate some of the things that we heard earlier in the program, that your dental care, your eye care, and your hearing affects social isolation. We heard Matt talk about periodontal disease and the impact on aging. We have a whole initiative at the Society that talks about oral health as an essential element to healthy aging. But in this session, it takes it even beyond, looking at what happens with your eyes and your hearing and the impact. We also have 2 new publications as we're looking at the community. There's an age-friendly university movement that's in place in the United States. Our university systems are looking at a financial cliff as the number of enrollees in about a decade are going to drop dramatically based on the recession. A few years ago, people stopped having children. So what are these universities going to do to bring people into their universities? One great way is to capitalize on the aging marketplace, and not the token kind of classes that are free for travel. These are real programs in university settings that integrate what we now call traditional students with an older population to make a real rich learning experience. That's positive aging. That's priming the next generation for intergenerational learning, and we'll have a better society because of it. We have a new publication called Longevity Fitness, and it's addressing, it might be a new concept to you or term. It's that people it's taking a look at matching health span, wealth span, and lifespan. I heard earlier that this generation has tremendous wealth. Yes, it does. There's a longevity economy also in which older adults are not a burden to the society, and there's been a lot of publishing on this topic as well. So I think this is a particularly interesting program, and it'll also be a momentum discussion. And then the last thing here is an initiative that the society is doing, and we look at, what can we do with aging and recalibrate it. Well, how we talk about it is immensely important. We often show pictures of doom and gloom, people in their 60s bent over. how we talk about the aging population really can change our mindset, but it's going to take a whole generation. And our society, with others, did tremendous research on ways, what does the research say about older adults? How do people perceive it? And what can we do to help mitigate how we talk about older adults so it's positive? It's not a silver tsunami. It's not frail elders. It's older people with tremendous wisdom. And so we have a tremendous program on this topic, and I'm happy to talk with any of you more about this as we move on. Encourage you all to submit to our meeting, a blatant promotion for our meeting. So professional societies have lots of interest groups that drive collaboration. And this is just a smattering of the interest groups that we have at the Society, and you can see many of these topics we've talked about our last couple days, but several of them are new. And that's something that societies look toward. Geroscience, societal implications of delaying aging. This is where people are getting together to talk about it. They're hungry for information, but it's really, when you get to the interest group level, if somebody wants to start an interest group, they can support it and it keeps it going, that means something is really making a lot of sense for that particular environment. We, as a society, do represent the organization at different professional societies, and we also work within a lot of different organizations. You'll see the dietary guidelines. We provided information in the upcoming guidelines from an older adult perspective. I didn't hear too much of that today, I'm sure just because of a timing, but all these, you can see the wide variety of areas that aging is influencing and the wide variety of areas that the GSA's involved. But they all have the same thing in mind, is how do we get our members engaged in all these communities and committees, coalitions, and workshops to drive the positive message and drive the research agenda. And then the last slide I'll say is that at the Geroscience Summit that Dr. Hodes mentioned earlier, GSA has many members who are speaking at that event, as well as our CEO, James Appleby, who will be speaking. So, you know, the topic of geroscience and metabesity is definitely one that's on our radar, and I suspect it's on many societies' radar. But, you know, the real incredible value proposition for societies when it comes to aging is that we can convene, we can collaborate, we can coordinate, and we can communicate. And in this field of aging, there's so many different players, and we all need to be working together. Thank you.